Dr. Scott Sigmund, hello everyone. We're here operating on a 17-year-old patient that had a right knee injury approximately 3 weeks ago, twisting injury. MRI scan confirms that the patient has a full thickness cartilage defect over the medial femoral condyle, and it's about a 1 by 1 centimeter lesion, really a perfect candidate for a microfracture, or in this case, a nanofracture technique. The technique to proceed is to basically position the arthrosurface device right where you want it to go. You want the actual bevel here, perpendicular to the actual bone itself. And then typically with a very light tap, 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 you're able to seat the actual device. The needle comes out approximately 9 millimeters with a 1 millimeter diameter. So you're really making a very small penetration through the actual subchondral plate, significantly smaller than if you were using a standard microfracture device. Now, the other really nice thing about this device in particular is this guitar pick device. The needle has a head here that you can see, and then with this guitar pick device, you have two options as to how you can actually back out the needle. One is to use your thumb gently pressing and pushing, which will back the needle out, and you can see that that's been removed from the actual obturator device. And then you can actually shift and move directly in the joint without having to take the device in and out each time. Another technique for a little bit of harder bone is that you can actually also tap using a mallet to be able to back out the needle as well. Those are both really two excellent techniques on utilization. So we're just going to go ahead and come in through our portal in our standard technique here. So here you can see our device in appropriate position here at the appropriate angle. What we're going to do here is just go ahead and now tap down nice and smoothly. Penetrates very nicely. You can feel that it hits its end stop. So there's really two techniques on how you can then back out the needle itself. I like the thumb technique. You're just going to gently push down on this guitar pick here, like so, and then the needle will back out. What's nice is that your obturator is still in place. You can then go ahead and shift your obturator where you want to go next for your next hole, and then you can go ahead and start the mallet technique again. Now again, if there's hard bone, what's nice is that the pick will stay up in this direction here, and then you can just gently get it started with the mallet, and then use your fingers to back out again. Again, that's a really nice technique in order to allow microfracture technique, or nanofracture technique in this case. Again, we're going to tap it a little bit with our mallet to get it going. You can come all the way out with the mallet as well. Also a good technique. What's really nice with this technique is you go about every 3 millimeters or so. And in so doing, you can then go back in and visualize that you can see marrow and blood products coming out through your penetrated zone. And using our mallet, we can then back the device out and move on to our next pilot hole.